Hey everyone, welcome back to another video. Today we have Dr. Nigar joining us directly from the OR. Thank you so much, Dr. Nigar, to take out time to share your experiences with all the candidates out there for the EMREE exam. It's been a tiring shift, obviously, for both of us, but glad that we could take out this time to shoot this episode for you all. Before we dive right into it, Dr. Nigar, can you just go ahead and introduce yourself so that everyone has an idea about you?
First of all, Dr. Mohammed, thank you so much for inviting me to this session together. I'm very excited to be part of it. And I'm Dr. Nigar Mehdieva. I'm from Azerbaijan and I have been living in UAE for quite long. But for my MD degree, I went abroad and I came back. And Alhamdulillah, now I'm here and OBGYN first year resident.
First of all, congratulations for matching into OB/GYN residency. It is a very big core specialty, and it's going to be a lot of fun and a lot of hectic as you go along, but I am sure that you will enjoy it. Dr. Nigar, before we dive into today's session, let us just go back a few years and how your journey to UAE has been. Can you just give us an insight about where you did your MBBS and how long was it before you matched into residency?
Okay, so I have studied my MD degree in Tbilisi State Medical University in Georgia. So it took me 6 years to finish it, along
Yeah.
with the intern. And after that, I have done my clinical attachments both in Georgia as well as in UAE. And yeah.
Wonderful. It's really nice to hear about you that you have come from Georgia. How was the system in Georgia and the education there?
Um, Honestly, I don't know how to compare it to the system in UAE because I haven't. I didn't have much experience here, and I didn't have much friends doing their MD degree here. But they're following the European MD program, so it
Okay,
was yeah, it was a European program that we were following.
perfect. You did your internship as a part of your curriculum course there. How was your internship year? Was it like divided into rotations, or how did you spend the year?
So basically, it was divided into rotations. So as we were having the subjects, we were having our, how to say, when we were having a rotation in one place, and our final year, it was counted as our internship.
Okay, so you
Yeah.
rotated in all departments as it's normal, 12-month clinical rotations as all over the world.
Yes, and after that, I have also done my clinical attachments to make it stronger, because usually students prefer to go for internship program after graduating, because like I had a lot of friends who graduated with me and they came back to UAE, and they have done their 1 year internship, even though they had the internship with them. So it is
Okay.
recommended to um, either to repeat your internship or to go clinical electives, just to, how to say, to not to have any gaps and to keep training yourself.
All right. I think that's a really strong point for all IMGs. A very, very crucial question that every IMG comes up with is about clinical attachments. So, being in an educational system abroad, trying to get into a residency or a career pathway in UAE, how do you feel about clinical attachments? Is it a good thing to proceed with, or all about your opinion?
Definitely, I believe clinical attachments are very important, even more important than internship.
Okay.
Internship is the basic thing that, just like how we have our MD or MBBS degree, internship is one of the basic requirements. But clinical attachment mandatory. It depends on you if you want to do it or not. But again, it's a very big point to do it because they're going to look at everything. It's not just about where you have graduated, it's not just about where you have done your internship, or it's not just about your EMREE score. So you have to be an overall rounded person.
So, Dr. Nigar, since you opened up about doing clinical attachments before you marched into residency, do you feel it's important where you do your clinical attachments before you get matched?
All right. So I think that once you get an opportunity, just jump to it. It doesn't matter whether you're doing it abroad or or here in UAE, because I did have a lot of opportunities in Georgia as well as in Turkey. our university was kind of like sponsoring us to go abroad for clinical attachments. So in my summers, I used to go there as well. So I want to say that every step of yours counts. So definitely, if you do it abroad or in UAE, it doesn't matter. But then I believe that if you come to UAE, if you have time, I mean, especially if you're an IMG who just comes straight to the exams, it would be better and wise to come here to do clinical attachment for at least a month, just to have an idea of how the system works here. Because when I came here, I was very blank. I had no idea how the system works, even though I've been living here. So my recommendation is, even if it's like, okay, even if not 1 month, even if it's for 2 weeks, just um, just have a try. I mean, go into it and see how things are going on. Of course, it's a big plus point on your CV again, but also like when you're in your interview, you can mention it that if it doesn't matter about the duration, just to mention itself that you have been doing your clinical attachment in UAE as well, shows that you have a big interest, that you really want to be here and you're doing your best. So it's not experience wise, but it's your interest wise. I believe it is important to include UAE in your attachment as well.
I think this is a very nicely put situation for all IMGs, because doing clinical attachments is going to give you an experience of the place where you are doing it, and also learn the type of modality of treatments they're going to use there. So I think, irrespective of the place you're going to do, you're always going to learn. And if you're doing it for the residency pathways here, it's a very good add-on where you can meet program directors, you can connect with colleagues, you can connect with faculties, consultants, and try to build your profile well. I think that's a really strong point. Thank you so much for that, Dr. Nagar. Moving on to the next question is, you matched into residency here. It is actually a dream for many IMGs to match into core specialties like general surgery, OB/GYN, pediatrics, internal medicine. So when did you actually start about this process in your mind that, okay, you have to go to UAE for residency, and what was your mindset? How did you prepare yourself?
To be honest with you, at first I was so hopeless. I didn't think even that I will be able to get into residency program here. It was my family that always like pushed me and gave me motivation to always give it a try. I was thinking of moving abroad to other countries to continue my residency. Also, I've seen on groups, on social media, and on internet, everyone's like, they're complaining that IMGs have no, how to say, have no space here, and they have very strict criterias. If you're an IMG, you have a very few percentage of getting in. But after I got into residency, I'm totally against this statement.
That's a very good catch up on the point, Dr. Nigar, that you mentioned about the backlash on social media and on various WhatsApp groups that you receive from different candidates having their experiences. How did you actually fight this out? How did you prepare yourself that this negativity is not going to be impulsive on you?
Okay, so I thought this that it's, I mean, whatever chance you get, you always have to grab it. So this was one of the options I had, so why not? Of course, when you make an option, you shouldn't just stick to one option. You have to have plan A, B, C, and you're gonna try one of them. I mean, you're gonna try each of one. And if it doesn't work, it doesn't mean it's the end of the world. So my plan A was UAE. So I was like, let's give it a try. But if things don't work out, it doesn't mean that I'm gonna go into depression, I'm gonna be sad and all that. The way how to start is to start with a positive outlook and to believe in yourself. Nobody is perfect, but if you just have the positive mindset and you keep praying and you keep believing in yourself, I believe that this is something anyone can achieve.
I think you have actually fought that battle really well, and that is what your hard work shows, that where you're standing today. But just to put out a note for everyone out there who's watching this video, and for all the other candidates out there, everyone will have a different experience going through the pathway. Some of them will ace it on, some of them will struggle through it, and some of them will not make it through. But always remember, you are just one person out of the whole crowd. There are many others, they are still eyeing the pathway, they are still eyeing to prepare for it. Your one misinformation or comment can actually demotivate and degrade them, and that is not something that is healthy even in healthcare and even for us as professionals, as physicians. So I personally feel if something doesn't go your way, you have to actually keep it to yourself and work on it to make something else that makes you stand out, rather than just falsifying information out there so that others will feel demotivated and not actually think about their abilities to choose from. This is really a very important point, and I think thank you so much, Dr. Nigar, for highlighting that it is something to look out, because that is what people are always looking at. Misconceptions and experiences travel faster than facts and truth. So absolutely, very well put up, Dr. Nigar. Now it's the hot topic for today, which is talking about how you prepared for the EMREE exam. So when did you actually start studying for it? How did you know about the portion, what you have to study for the exam, and what all did you do?
Right. So I started studying 3 months before my exam, which was on Feb. So the way how I studied was to go through the EMREE files, the main EMREE file, and not just once, and not just memorize it, and not just look around the questions. That's not how you're going to pass this exam. You're actually going to sit and study everything. When you see the question, I mean, the past paper is not there to memorize. The past paper is there to guide you on the topics, on the subject areas to focus on. So as I was going through the questions, I was going back to my books and to my notes in my medical school years that I made. And I was just, brushing up my memory, brushing up my knowledge. And I was always questioning, why is this option correct? Why this option is not correct? So when you look at the other options, make sure that you go through those topics as well. Because it means it's still the area of the focus.
Correct.
Yeah, there is no exact source for EMREE, unfortunately. This is what I will. This is what I can guide for the coming students for the EMREE exam. That when you look at the question paper, always question why is this correct. Even sometimes it may not be correct. So do your own research, and as you do your own research and you, how to say, you find your own resources, it's actually gonna stick on your mind. So when in the exam, when you will see a similar question, you will already have the answer on you. I mean, with you. To be honest with you, some students they were like they had a lot of similar questions coming up in the exams. But during my batch, when we went to the exam, around 90% of the paper was different. But what saved me was actually studying. And when I say studying, I don't mean that you should go buy a USMLE book or some book and just keep memorizing that. No, you have to study with the question papers that you have. So, how to say, it goes in combination.
Correct. To add on to this point, it's very important to note that every candidate that's applying for this exam is obviously a graduate who has completed his MBBS studies. So obviously, whatever your basics is to be learned is to during those 5 or 6 years that you've spent in medical school. Otherwise, then what is the outcome of you going to a medical school? So that is the basic where you will learn it. And this examination is going to be a step up where you refresh your knowledge, where you crash course, commit everything towards, in a small time, cram it up, and then try to go and perform it with all the basic knowledges you have. But again, if your foundation is weak, whatever question that comes, you will not be able to think logically and give that answer. So it's very important to make sure that your basic is strong. And I think that is what we have to build up from the start.
So, when I say it took me 3 months to study, it doesn't mean that everyone should take 3 months as their timeline to study. No, maybe, maybe you may need 6 months to study, maybe you may need 1 year to study, or maybe you may need just 2 weeks to study, not even 3 months. So, it all depends on you how fresh your mind is with all the materials. So that's why I keep revising, especially if you're in your final year. Go through all the main subjects, like go through OBGYN, internal medicine, psychiatry, all the, how to say, all the backbone subjects of medicine. You need them. So if you keep, how to say, refreshing your mind, when you see these questions, you will not be surprised.
Correct. It's basically the core specialities where they concentrate much during the exam, because that is what you're going to face in the hospital eventually. If it's internal medicine, you're going to have to focus on what's the diagnosis, treatment, management. Same with surgery, with OB-GYN, with pediatrics, with biostatistics, with family medicine, dermatology. So you need to know at least the basics of how you can actually take care of a patient when they come to the hospital. And that is what is the basic knowledge that they're going to test in the examination for you. Moving on, you used 3 months to prepare for this exam. What were the specific resources that helped you study during these 3 months?
All right. So it was the EMREE file, the main EMREE file that helped me. And also, I was referring to some topics from Plab Notes, Plab, and also my own medical books that I had in my university years. Like, it's not a specific book to follow because there is nothing specific for EMREE. Again, it's just the stuff that you have studied in your university years. So as you go through the questions, you see what are the topics that are being asked often, or what are the differential diagnoses of this disease. Like, for example, if the question may ask something else, or if it's a similar case, like, you will know that what areas to focus on, like what areas to focus on OBGYN, what areas to focus on internal medicine, what topics are asked on psychiatry. This way you will be able to focus on specific areas, particular subject. So I
Okay.
will not one specific book or one specific source, because for everyone it's different. What I may have studied from may not be easy for you. Maybe you have your own ways, your own notes, so it's different for everyone at the end.
All right, I think that is a very clear on what type of materials they can use. Basically, starting up with the past papers as your backbone, and then you start using your own notes from medical school, or you refer to AMBUS question banks. That is one of the most really helpful sources currently that many graduates have praised it. And you can also even use first aid step 2 CK books, your textbooks, as per your convenience for the topics that you want to read.
See, it's different for everyone. Like, I never liked the USMLE Step 2 CK book. I can never use it because I feel like everything is just like facts there. And me, I'm a person who likes to dig deep into the topic and understand why this is right and why this is wrong. So that's why it was not a convenient source for me. But again, it's different for everyone.
All right. Dr. Nigar, when you were preparing for these 3 months, I'm sure that you were working as well during that time as an intern. And how often do you spend studying in a day or in a week, or how did you plan your schedule?
Um, Again, for everyone, it's different because everyone, how to say, has their own. Like, maybe someone may take 5 hours to study, but in that 5 hours, they will study only for 2 hours and they will be in chill mode for 3 hours. So, honestly, I'm not counting hours. Like, whenever I had free time, I would just sit and revise. But in average, it would be around like 5, 6 hours a day.
Okay, I think that is one of the minimums that you should actually keep to focus on this exam. If you're trying to cram up or have a crash course, that you need to spend a bit more time, because I feel people who take an off sit at home and prepare, they are at an advantage of more time. But again, this thing does not require you to be off. Even if you're working, you can actually work on it. It would require a bit more of your energy, but again, it's all possible at the end. um, Before you went and took the exam, when you were studying through those 3 months, how did you evaluate yourself that you felt, okay, I might be ready for the exam, I should take it?
Honestly, until last minute, I didn't feel I'm ready. Even I was thinking of postponing my exam. But then I kept, how to say, repeating the materials, repeating my notes. Like, wherever I used to make mistakes, or the topics that wasn't clear for me, I used to highlight them. I used to, like, have a note with me and used to write the topics that I'm not good at, my weak areas. So on my last days before the exam, I was just going through those topics or the questions where I had problems with. So I think this is the fastest way to repeat, especially when you have no time. I mean, not to repeat. I mean to evaluate yourself. And if you want to evaluate yourself based on the questions, it's very simple. Just have the unanswered version of the question paper just for practicing. and to see what you remember.
Okay, I think this is one way that candidates can actually use to understand how well they have understood the questions, how well they have understood grasping the knowledge of what they are going to ask. Because it's very important as a student to always be in the third shoe, be in the shoe of the examiner, and then think, what are they focusing on? What are they trying to ask you out of it? And one effective way I found that many people have also used is to do it in a group study. At least have a study partner, because if you have a companion with you, you can actually target questions at them, assess each other, and then they can assess you, and it becomes a healthy competition where you can actually know where you actually stand and where you have to work on, which topics you will have to focus and stuff on that. Dr. Nigar, do you remember what were the high yield topics that were asked in your specific paper?
Definitely. The thing is, I do not remember the specific questions, but I will tell you what areas I got more questions from.
Okay.
From OBGYN, from my
Okay.
special, and psychiatry as well. There were a lot of questions from psychiatry, and a lot of questions came from statistics as well.
Okay.
So maybe a lot of the students who are preparing may skip the statistics part, but I would recommend not to. Make sure you know the statistics part very well. If like yeah, these three areas were asked a lot in my paper.
Okay, I think this gives them an idea of what they can ask. Here, I have two takeaway points actually for all students that are preparing. First is they are going to be recall questions as well on the paper. And second is I feel that there is nothing like a tough paper. It's something like I don't know the answer, because in an MCQ, it's very straightforward. They ask you a question, be it anatomy, be it physiology, it's already there as science on paper, on books before. So it's either you know it or you don't know it. So you might have studied and prepared for it, so you know it. And if you don't study for it, you absolutely don't know it. So, it's a ratio of how much you know about the topic rather than the paper being a bit hard, bit, tough or something. But I always take it on myself that if I don't know an answer, I'm not well prepared for that exam. So this will actually this will actually make you more confident on yourself if you start looking onto your mind and start preparing it earlier, that if it's a recall type based question and if it's straightforward, I should actually know the answer. And then you will actually go ahead and you will mark those answers as per the way they are asking you in the exam. And the second point I wanted to say was that there is no topic that is going to be high yield according to the examiner's perspective. Why? Because this paper is going to test each format individually. So you will have allotted questions to each topic. For example, internal medicine will cover 20% of your paper. OB-GYN would cover 15% of your paper. But again, these are all so randomly selected that there might be sometimes you're going to have questions on a few topics that are going to feel more than the other. Like for example, if you did not study statistics well, you have four questions and you'll be like, oh my god, I started the paper with four statistic questions. There were a lot of statistic questions in the exam. And second, it's all these topics that they have allotted to you. It all is in accordance with the criteria that is there in the blueprint that is already released by them on their website. So if you would have a look at it, it is very extensive. But again, how much you are comfortable with it, how early you grasp almost all the topics on it, much better for you to appear for the exam and the paper.
I would recommend the earlier you start, the better. Like, don't keep it to last minute because no matter how confident you are, like, no matter how genius, how intelligent, how smart you are, I would still recommend you to start earlier. Like, even before 3 months. Like, there is no harm in it because anyway, you're gonna need this knowledge even when you come to residency. For example, gonna need some internal medicine, general surgery, even psychiatry. All of the subjects are interlinked somehow. So it's for your own benefit.
Absolutely. I think you very rightly said this, because even for us as surgeons, when we admit patients, we might have a patient who is diabetic, who is hypertensive, call up internal medicine and say that, oh, I have a patient with diabetes. Can you prescribe him insulin? No, you need to know the doses. You need to know the basic line management on how to at least acutely take care of them when they arrive in the ER and you're admitting them into the ward before you ring them up. And I think this is very important for us all at a basic level as first year residents, second year residents, to at least manage them. Yeah, when you become a specialist and consultant in your field, you will be more focused on your part of work And obviously you will have the required information by then. But again, start early, think as a consultant from day one, because that's where you're going to end up in your career field. And it's very important for you to start acting that way if you want to become that one day. Dr. Nigar, this is one more important question that IMGs actually look out is, oh, the examination is based from UAE, so UAE candidates will do it better. All the local graduates from there will actually ace the exam. What about us? So how do you feel was your MBBS training, and how did it help you for the exam?
So, regarding this question, I would like to highlight education. It may be different in Georgia, it may be different in UK, it may be different in UAE, but at the end, it's you who's putting the effort. Maybe some students may say that, oh, we did not have good education, the program was different, it's not matching. But then the general medicine is the same thing all over the world. So I believe at the end, it's up to the student if they want to ace it, if they want to be a good doctor, if they want to study. It all depends on you. That's what I have understood.
I think that's a very important point again, because it doesn't matter if you had a clinical exposure well on before, if you can do lumbar punctures, if you can take an arterial line, if you can do central lines from before, but it all implies, do you know what that thing is? Do you know how to do it? Do you know how to prepare for it if it arises? And then obviously hands-on trainings, practical training, simulation trainings will all happen on the job while you're working here. The most important thing is, what were you sent to do for the 5 years in your medical school? Are you fulfilling that criteria? Do you have the basic knowledge? Do you know what every person who graduates from an MBBS should know? And that is the most important thing coming out of any medical school. Moving on, almost towards the end of our very special interview with you, but what are some tips that you want to give for graduates who are preparing for the upcoming MBA examination in December?
My best advice for everyone, don't be standard. Like, don't just focus on scoring high Emory marks, because that's not how it's going to be. They're going to look at you, at your personality. What do you do? What do you do outside medical school?
They are not looking for just bookworms to come join residency trainings, because at the end you're going to take care of a patient. They have to understand that, are you compassionate about it? Can you take care of patients? Do you have a good character, good morale, good ethical values? And so it's important for you to excel in medical career line, and also in extracurricular activities, volunteering events, attending conferences. All these things will add up on you as a person. It will add feathers to your cap before they actually shortlist you. So one thing you can prepare on is, as a medical student or even as a graduate, is on your CV, is on your GPA before you prepare for MRE and interviews. And then at the end, it's going to be a holistic approach where they're going to take all of these courses together before you march into residency programs here.
Exactly.
All right. I think before I end, just the final question that is on you. You marched into residency in OB-GYN. How do you describe the program?
Honestly, it's a very lovely program because I always had an interest in OBGYN, but I never knew that I could actually get into OBGYN. And definitely it's very challenging in the beginning because even though we had it in our medical school, it's different when you're a resident. You have more responsibilities. You're actually taking care of patients, and sometimes you are left alone to take care of the patient. So all of this is uh, quite like a roller coaster in the beginning because it's just my first month here. But all in all, it's very exciting. It's it's kind of like emergency, but for women, you know.
Yes, correct. And how are you managing the OR life and the wards and the clinics? How is all this department falling for you?
All of them have their own beauty, you know. There is something nice about all of it. So I think it's all about time. Don't push yourself hard like, oh my god, I don't know anything, it's so challenging, it's so hard, or the timings are very bad. You will get used to it. As long as you love what you're doing, um, all these will be, how to say, just excuses. Like, to love what you do and go for what you love to do.
I think that's a very beautiful message towards the end. And I hope this inspires all the IMGs that are looking at you to prepare for this pathway and hopefully match into the residency choices that they are looking at. And we wish them the best of luck for their exams. Thank you so much, Dr. Nigar, for joining. It was a pleasure having you.
Thank you so much. Looking forward to many more podcasts and wishing all the best to all the doctors who will be at the exam.